Prostate MRI is a new technique for screening for prostate cancer and for monitoring for prostate cancer. Prostate MRI has evolved out of regular MRIs, magnetic resonance imaging, which is a methodology most of us are familiar with. It's been used to evaluate kidney problems, liver problems, and when you redirect the imaging to the prostate, you can now, with modern technology, see potential tumors inside the gland. And this is a fairly new development. Only over the last couple of years have people learned the proper way to do prostate imaging so that you can get useful information. There are two important developments with this new technology. One is the possibility of not doing prostate biopsies so frequently. Prostate biopsies can cause infections, and they're uncomfortable, and they have other problems as well. And so this is a wonderful opportunity to bring new technology to bear and to save men the discomfort and the problems associated with biopsy. The other important development is that men who have low-grade cancers can, we know now, safely be monitored. Historically, biopsies were used for monitoring as well. And so these MRIs are a very natural way to keep an eye on these low-grade cancers to make sure they're not growing or they're not causing problems. And if there is a problem, these imaging studies with MRI can detect it early, and men can get treatment in a timely fashion and get cured. So the wonderful thing with MRI imaging and also with the high-resolution ultrasound is that we now have a safer way to detect cancers early, and we have a safer way to monitor the low-grade cancers, the ones that can be safely watched over time.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.